All right. It is just after 3:30 Eastern Time, so I'm going to get us started. My name is Carolyn Stampfel, and I'm delighted to join you here today to talk a little bit about AMCHP's 2024 Annual Conference Call for Proposals. This is how we solicit conference input for all of the skills building sessions, workshops, posters, and roundtables that we'll have at the AMCHP 2024 Annual Conference. I'm joined today by my colleague Michelle Cruz from CM Event Solutions, and we'll be fielding your questions towards the end of the time together. I'm going to walk you through the call for proposals, so we'll get to all of that in 1 second. I did just want to let everyone know that we're recording this webinar so that we can share it with folks who weren't able to join us today. So hopefully you know by now that we'll be in Oakland, California in April of 2024, April 13th through the 16th, so save the date. And I wanted to start by anchoring us and grounding us in our purpose. Why does AMCHP have a conference? We do it for many reasons, but I want to ground you in four of the reasons today. One is for visibility. It helps us to highlight the impact of maternal and child health programs, and those impacts are seen at the national, state, and local levels for women, children, families, communities. It helps us to provide resources to our participants. So we provide them with methods, tools, and resources through all of the sessions that we host during the conference. And these help to sustain MCH programs and services across the country. It's our largest networking event. Last year, we had 1,300 people join us in New Orleans. So we typically now get over 1,000 attendees every year. And so it's really one of the largest gatherings of maternal and child health leaders across the country. And also impact. We've learned from post-conference evaluations that respondents report that they have taken one or more of the concepts, skills, or tools that they learned or got at the conference and applied them to their work. So when we think about the purpose, the grounding, we want to have an impact. So I'm going to invite you all to listen and learn as we think about and navigate the conference. The call for proposals. I'm going to talk about the theme, give you some key dates to put on your calendar, and then I'll walk through the call for proposals elements. So the session types, the body of the proposal, the tracks and keyword tags, and then some information about presenters, and then how do we review the proposals in order to get to a schedule of sessions that are selected, and then we'll have time for questions and answers. You can always chat things in using the Zoom chat function. I'm happy to keep an eye on that, but I'll probably save most of the questions for the end. So first, our AMCHP 2024 conference theme is partnering with purpose. Hopefully you've seen that now in some of our materials, but I wanted to share with you how we're thinking about partnering with purpose. So when we think about this theme, we know that we have the power to be intentional about who we partner with and how we engage. Our theme calls us to be humble, to know that we don't know everything and we can't do everything on our own. And we recognize that we can do more working together. It helps us to clarify our intentions and think about how we can combine our resources, our ideas, and skills for greater impact in communities. And the theme asks important questions about power. How do good partnerships share and build power? How are our partnerships amplifying the voices of the people we serve? We believe that partnering with purpose means being authentic, and it's based in relationships rather than contracts or outputs. And it's the opposite of being self-centered or insincere. When we think about partnering with purpose, it encourages us to think about seeking out new people and new organizations that we may not have worked with before, but have similar vision and goals as we do. So that's how we ground ourselves in our theme for the year. Some key dates as you're thinking about the call for proposals. It opened on September 8th. We wanted to give folks some ideas about, what we're looking for before we did a webinar. We haven't opened registration yet. I think it's actually going to be November. I'll update the slides before I send them out. The call for proposals closes in November, and we're going to hold firm on the closure date so that we do not extend the deadline. We do have a pretty tight timeline of how we have to review and turn things around. And so we'll be going through session selection the last week of November. Acceptance notices will go out by December 15th. Our early bird registration will close February 12th, and then we'll have the conference in April. So now I want to give you an overview of the types of sessions that we have at the AMCHP conference every year. So we have 4 types of sessions, 2 on this slide, and then I'll talk about the next 2. So the first is skills building sessions, and these are typically hosted as pre-conference sessions. So they're going to be on the early side of the conference. These are longer, they're 3 hours in length, and they're designed to teach a new skill, a new method, a new tool, so that participants can apply them to their work. This is a session type that requires you to include a schedule of your planned interactive activities and the skills and tools you're teaching in order to complete your submission. And we want you to share a little bit about what you expect participants to come away with to apply to their work. It's really important to remember that skills building sessions are only being offered in person because they're so long and they're meant to be highly interactive. For workshops, these are our main body of the conference sessions. These are held concurrently, so we usually have 6 or 7 workshops running at any given workshop block, and they're 60 minutes in length. These are more informative sessions. Usually there's a presenter or a panel of presenters sharing some perspectives. It includes some audience interaction, and we like you to save about 15 minutes for question and answer. And this year, as we did last year, we're offering the opportunity to have workshops both in person and virtually, and that's for presenting and attending. So we'll have virtual presentation options and virtual attendance options this year. So we are running a hybrid conference. Next is posters, which are a graphic presentation of your research or program results, whatever your topic is. And we give you some guidelines for how big to make that. We wanted to make sure that you knew that all poster presenters, regardless of how you have requested to be, if you want to be in person or if you want to be online only, we're asking everyone to make a digital version of your poster and a brief audio recording of about 5 minutes, no more than 5 minutes, narrating the poster for virtual participants. That way we can build a really nice poster library that's accessible to anyone who registers for the conference. If you are presenting in person, you're required to bring a physical printed poster to be displayed in the exhibit hall during the poster session hours. And we do ask that one author is available at the conference to set up the poster, answer questions during your designated time, and then take the poster down. And then last are our student and early career professional roundtables. So these sessions are 60-minute live discussions, and it's an opportunity for students and early career professionals to really tap into the expertise of people in the field. And so we ask that these submissions are not necessarily a fully completed project or a fully formed topic. They're actually working submissions. So when we review the proposals, we're looking to create a roundtable session where folks are sharing about 5 minutes or so on a topic that they're exploring in greater depth, and then including questions that they'd like to ask the audience for which they're seeking some guidance. So there's going to be time after each presentation for attendees to discuss and engage with the presenter. These are highly engaged presentations, and we ask that our audience comes prepared to really engage and provide their best thinking and feedback. And so we are also offering these sessions in person and virtually. So now that we've learned a little bit about what the proposal sessions are, I want to walk you through some of the body of the proposal. How do you go about describing your content in AMCHP's call for proposals system? I'm going to show some screenshots too to sort of orient you to the system. So just to give you a big picture overview, AMCHP doesn't use a traditional scientific format for the proposal submissions. I know a lot of people, when they log onto our system, they're looking for that abstract box, that place where you put your whole body of your proposal. And we moved away from doing that because we found that people were leaving out important information for the reviewers. So what we're doing now is using questions to guide your submission. So we're asking you to think about and describe what's relevant, impactful, cutting edge, and important for the conference audience to know. And then proposal reviewers use your responses to those questions to evaluate whether or not the session scores well against the criteria. And I'll share the criteria at the end. So we ask you to imagine that you're explaining your practice, your program, topic, analysis, initiative to someone who's never heard of it before. And we this year expanded the terms that we're using. So hopefully you can see yourself in the questions. So we're using things like practice, program, project, initiative, analysis, all of those things apply when we think about the types of proposals we're looking for at the AMCHP conference. So here's a screenshot just to give you a sense of some of the questions that we're asking. So we ask you if you'd like to be considered for another type of session or a poster. If your preferred session is not available, are you one of the presenters, or are you doing this on behalf of someone else? And then we have our conference objectives, and we ask you to select at least one that you are going to address. We have two objectives that are related specifically to our conference theme, and then the remaining objectives are really more generally about what we're trying to accomplish with the conference. So this year, we're asking about identifying practices and policies designed to grow and support partnerships in maternal and child health. So that's our partnering with purpose, and then discovering methods to build authentic intentional partnerships. So those two are specifically related to the conference theme, and then the rest are more general objectives around what we're trying to do. Next is when we start question number 5, I think it will be for most of the submissions, is when we start asking the questions that help you to build your proposal. So at first, we ask you to provide a really brief summary of whatever it is that you're submitting, the program, the practice, the project analysis. And we'd love to hear a little bit of helpful background information. Put this in context for us. What are you trying to share with us? And then we ask a series of questions about who is impacted, what need does it address, how did you identify the need, and then how does your practice or project or initiative benefit the key population. For each of these boxes, we're asking for a response that's about 500 characters. If you go a little bit over, I think it will still allow you to keep typing, but folks asked us last year for a guideline. So we decided on 500 characters just to help give you a guide. It doesn't have to be a dissertation. It just needs to be enough information so that reviewers can understand what you're trying to say. Next questions include, how does your, I'm just going to say practice for now, how does your practice contribute or work towards reducing health inequities and systemic oppression? And you can include elements around structural racism that impact your key population. Describe each of your collaborators or partners and why you partnered with them. And then we ask about how you meaningfully include people with lived experience, and describing successes of your practice. And so again, those all have a suggestion to keep your response to about 500 characters. And I'll show you later, these all align with our review criteria. And then next we have, what important lessons have you learned? You can share things that you learned that were sort of positive or negative. And then if you're submitting a skills building or a roundtable session, this is where you'll provide the outline of your interactive activities. If you're submitting a workshop, this is a little bit of how you can structure your workshop and have some key takeaways or objectives. And if you're submitting a poster proposal, you don't need to go through that process. And then we're going to ask you to provide a short description for the online agenda. And this is what gets published in the AMCHP materials. And then what we'll do is suggest to you, so you have 800 characters, you can cut and paste from some of the other questions. You don't have to include detailed methods, but this is the thing that participants will read when they're trying to decide if they should come to your session or not. So that this description is really how you want to appear in conference materials. I see some questions are popping up in the chat. So I think after I get through the proposal body, I will take a look at the questions there. And I think we're almost there. We do ask you to select a track. And so this year's session tracks, the conference planning committee spent some time honing down the tracks, so there weren't quite so many to pick from. And so you'll pick the track that best describes or best aligns with the content that you're sharing. And then we ask you if your proposal relates to the conference theme, partnering with purpose. And if you think, yes, it does, tell us a little bit about that. And if not, which is okay, how does your proposal talk about and advance the practice of maternal and child health? So you have options. It doesn't have to be all about partnership. And then this year, we're introducing a new element. Since we pared down the number of tracks, we have keyword tags. So we're asking you to select a keyword that best represents or best describes the work that you're doing. You can select multiple keywords. And then I'm going to finish, I think, just this section, and then I'll take a look at the questions that are coming up in the chat. What's your preferred method of presentation? The options there are going to be in-person, hybrid, I'm not virtual, or I'm not quite sure yet. We're going to ask you, if your proposal is selected for an in-person workshop, if you'd be willing to self-record your presentation, because we'd love to have a library of presentations available on the website that folks can watch on demand. We did have just over 300 virtual participants come to the conference in 2023, but more people accessed the online platform, even folks who were in person, to watch sessions that were recorded. So it is helpful and appreciated if you're willing to do that. And then we are using a joint submission process where we do automatic referrals to our MCH Innovations database. So you have the option there to decide if you'd like to be considered for inclusion. And if not, are you interested in learning more about it? So I'm going to pause here for a moment and take a look at our chat. So I have questions from Heather. Can someone pre-record a presentation? So for virtual attendance, the format that we're going to use is either we're going to live stream sessions that are happening on site in Oakland, or we'll be hosting them live on Zoom. So at this time, we're not doing any pre-recorded sessions. And then the second question was, can someone attend the Q&A portion virtually? So in those two formats where we had a live stream session, people who were watching online as a virtual participant could ask questions through the chat, so they can participate in the Q&A virtually. We did not have the option to have presenters in that live stream session who were virtual. It was harder to navigate the technology there. When the sessions are hosted on Zoom, anyone can participate in the Q&A. Next question from Supraja. If the response is beyond 500 characters, does the system still accept it, or would the reviewer still read it? Yes, the 500 characters is a guideline. So we ask you not to go too far beyond that, but yes, we will be able to see everything that is typed in. I will check with Michelle and see if there is an actual limit. You may come up against an actual limit, but 500 characters is a guideline for that.
And I can answer the limit question. So
Yeah.
if you go ahead and go over the 500, it will not cut you off. But again, we just want you to stay as close to 500 as possible as a guideline.
Great, thanks, Michelle. So, and the next question from Martine, if two organizations are applying to present together, how does that work? So we ask you to collaborate on your proposal creation, so answering all of those questions. I'm going to walk you through the presenter information, and I think that will help clear up exactly how it works. But basically, one person is designated to start the submission and is really like the submission leader. And then you can add all of the participants to it. And then I'll show you there's a button to invite presenters to complete their work. But you should do the collaboration piece first to do all of the sort of writing and answering the questions and putting it into our proposal system. And then you have the opportunity to invite your presenters to just confirm all of their information. Next from Catherine, does the application need to be completed at one time, or can it be saved and returned to? You can definitely save and return. If there's questions that you can't answer on the page right away, you can always put a little placeholder in so you can save the page and come back to it. Michelle, I want to make sure I answered that correctly. I think that's true based on my testing.
Yes, that is.
Okay, perfect. Okay, so next question from Wei Sum. Is the 300 virtual attendees included in the 1,300 attendees for last year's conference? Yes, so I think our official number was 1,326 attendees total. We had about 80% or so of people in person and 20% virtual. Question from Mary. For those who would like to present a poster, are you required to attend the meeting in person? So if you would like your poster to be, let's see, if you requested to have an in-person poster and that's what you're accepted for, then someone does need to come in person to put up the paper poster. If for whatever reason you're not able to attend in person, you can still do a virtual poster, a digital poster. So you don't have to attend the meeting in person unless you need to be there with the paper poster. Okay, next question. Do you have info on the demographics of the conference? For example, whether the attendees are mostly clinical providers, program implementers, corporate staff, et cetera. So we do, and the attendees mirror pretty much who we reach as an organization. So primarily people who are working in state governmental public health and maternal and child health, local governmental public health, academia, so public health programs working in maternal and child health, and then students and youth and young adults, family leaders, people who represent community-based or community-rooted organizations. We do have some folks who are in some kind of clinical practice, but that's not the majority of our attendees. So definitely more so on the program implementation side. Next question, can you post the tracks list in the chat or slides be available at the end? Oh, thank you. Somebody posted the tracks for us. Thank you. That's perfect. And then Michelle included a link to the call for proposal site, which has the tracks right up on the front. And I am going to share the slides with you. I'm noticing as I go through, there were a couple typos, so I'm going to correct those and share them with all the registered participants. And then would there be any scholarships available for presenters to cover the registration costs? So that's a two-part answer. One is that we do offer discounted registration for anyone who's accepted as a presenter. So yes to that. And then we are working on a scholarship process. And so more information will be coming out on that. Next question, is there a quota for the number of abstracts accepted or how competitive it is? There's no quota. I think in years past, when we were wondering, if the number of submissions seemed kind of low, we would extend the deadline. Recently, we have not extended the deadline because we've gotten so many submissions, and we are, looking at filling a certain number of slots. So we're going to do the calculation out there for, 7 concurrent workshop sessions, and then how many of those slots do we have? How many can we accept? Things like that. What does representation of evaluation, either focused or on evaluation of projects or programs, evaluators look like? So I'm thinking that you're asking that as part of the what does it look like to submit a proposal that talks about an evaluation. So I think you can take a look at the questions from the perspective of, my proposal is all about an evaluation. So what is the particular sort of population that was being served through the program that's being evaluated? What are some of the key impacts? What did you find? So I think you can sort of work on and translate the questions to fit the type of proposal that you're trying to do. And if you're struggling with that or having any questions about how your content fits into the proposal, you can always reach out to me, and I'm more than happy to help work through how to sort of craft your proposal to fit in with the questions. I have one more question here, and then I'm going to finish the presenter information. I'm loving this. This is fantastic. So, are we allowed to collaborate or have a team for one proposal? Is there a limit in terms of the number of people? That's a great segue question, because I'm going to answer that with the next slide, I think. Yes. Okay. And yes, I will definitely put my contact information in the chat. Yes, deadlines and key dates will come back. Okay. So, for presenters, your proposal can have up to 3 presenters and 1 moderator. And we made some changes this year because so many people asked us about this. It used to be that you could only have up to like 4 or 5 people total. But what we heard last year was that folks wanted to acknowledge people who worked on the submission. They know they're not going to come and present because we don't have space to have 10 people present in a session. But you can add up to 10 additional co-authors or contributors that will be listed in the program if the proposal is accepted. So you can have 3 presenters and 1 moderator, so 4 people presenting in a session, and then up to 10 more people listed in the program if they contributed. So that's how we're handling the sort of the authorship and presenters piece. We do collect detailed information on authors for our application for CDC continuing education credits. And I just wanted to say here, and I'll say it again, we don't use this for scoring or selection. We include an acknowledgement that all authors know that they're being included as part of the terms and conditions. So you will have to at some point certify, yes, that everybody knows that they were a part of this process. So that's just some big picture pieces around the presenter information. Next. Here we go. So we ask for the presenter profile. So this is what you'll see if you're the person who's filling out the form or if you are added as a co-author. So we just ask for some basic details about how to reach you, where you're from. And then we have some stuff that's collected as part of our continuing education application. So they do ask us to report on like what's a person's position and an affiliation, any degrees or certificates they have. The presenter role will be, are you a speaker or a moderator or another author? And then the organization type, we're just trying to understand like where are people coming from in terms of community-based organizations, nonprofits, government, things like that. And then we ask about, are you coming to this work as part of your being a student, a youth or young adult, someone with lived experience? So we provide some uh, categories here that you can select if you identify in that way. Those none of these pieces are used in scoring. This is all for us to understand more about who's submitting proposals. And then you can choose how you heard about the call for proposals so that we can track our communications. Um, and then adding some additional expertise specific to the session proposal. This is one of the things we have to provide for continuing education credit. Again, we have to ask some of these questions like, are you a federal employee? Is there any off-label use for products? And then is this supported by the best available knowledge or evidence? Those are all part of the CE application. And then we do ask for um, some demographic information. All of the categories for gender, race, ethnicity, and age are optional. We ask that you complete them if you feel comfortable. But the bio sketch is required, and that is information that will be published on the conference website to help introduce folks to you and your proposal. If you have collaborators, what will happen is you can add them to your profile. You can fill in information if you know it. But if you're not sure about how to complete that information, you can invite someone to go and complete it. So if I'm a co-author as an intern at AMCHP, I can go in, I'll get an invitation, I'll go into the system and I'll complete my information, and then I will complete it and certify that I have been a part of this process. I am going to review the terms and conditions, and then I think I'll come back to the chat and see if any new questions have come in. So for the terms and conditions, these are all things that we just want to make sure that you have seen and understand before you submit your proposal. So we want you to know that the information that you put in here, the title and the description, will be used in the agenda. We require any presenters to register for the conference. We ask that presenters bring a laptop unless you have otherwise arranged it. And if you have trouble with bringing a laptop, we can work on that together. We have a photography and recording release because at this outset, we don't know exactly which sessions will be live streamed or photographed. So we do ask all submitters to agree to the release. We ask that all authors know that they've been included in the proposal. We ask that you acknowledge our meeting code of conduct. And then we know, and everybody knows now, I think in this day and age, that travel plans can change. So we know that and acknowledge that you have expressed a travel preference at the time of submission and that could change over time. So this is just a summary. I do encourage you to read carefully all of the terms and conditions so that you are aware before you agree to them. So I'm going to pause here and see what new questions have come in. Let's see. Would a proposal be considered for a poster if not accepted as a workshop? So that question gets asked right at the beginning. So if it's, I think maybe the first or second question, and says, if you are submitting for a skills builder, a workshop, or a roundtable, and it's not accepted, are you interested in a poster? So if you say yes, then we'll offer you a poster if we do get to that situation. Let's see, next is, are my proposals from programs that have been implemented in a different country accepted, or are local programs preferred? So I think that question is more so, I think more so about how you describe the relevance to this audience, knowing that it's primarily going to be an audience of people coming from the United States. So I think making the connection from where your context is to this context is really important. A few years ago, we did have a global meets local theme, and we had tons of international project and program examples in our proposal. So I think it's really important just to make those connections. Like, what would this audience be interested in hearing about from the experiences that you've had? Next, is it possible to submit a program proposal without any crude results at the moment? The program is currently being implemented and created this year. However, next year we should hopefully have some results to share. I mean, you're welcome to submit what you have now, and it will really be up to the reviewers. So I think when we go through the review criteria, maybe that will help you sort of make a decision on whether or not you want to go forward or if how you want to frame what you have now. But I will say that because it's not a typical scientific abstract, it's not like there's a section that says results and you won't have anything to put in there. It's more so descriptive. What is the program? How is it impactful? You can also share in those review questions that you don't have 100% of the information yet, but if you have some promising results to share, that might be helpful. And I will go through the review criteria next. Next, how does the 3 presenters and 1 moderator limit apply to the poster session? For posters, I don't think there is necessarily a limit, although just from a space perspective, it can get a little crowded. I think 1 to 2 people at a poster is useful to be able to field questions if you're co-authors. More than that, it might get a little crowded, and we don't use moderators for posters, so you don't have to worry about designating a moderator. See, the questions have slowed down. I did want to check in with Michelle and see if there was anything else you wanted to add.
No, but I do want to clarify, you can have 10 co-authors on a poster as well.
Right.
So I believe that you're only allowed 1 presenter. Um, and then if has to switch because of travel, all you have to do is just let me know and I can make that update. But 10 co-authors is still allowed for boosters.
Great. Thank you. All right. So how do we score proposals? And this also it's a little bit new for us. We didn't used to share our review criteria. So this is new for this year, and we're looking to see how it works. But we use a scale from 0 to 10 for each of the criteria. And then these are rated by our reviewers in a blinded fashion. So that just means that reviewers don't see any of the presenter information. They're only looking at those questions that are the body of the proposal. We do ask if a reviewer recognizes that the work that they're looking at, the proposal is something that they were involved in, that they step away and let us know that they shouldn't review that because that wouldn't be fair. And then we just take that proposal and reassign it to another reviewer. So we want to make sure that every proposal has at least 2 reviews. We try to have 3. We ask people to be reviewers and designate their what track that they're most comfortable reviewing in. But every once in a while, someone will send one back and say, I'm not really qualified to review this, and we find another reviewer. So that's how we sort of manage the review process. And then when we look at the criteria, I did want to just reiterate things that don't get scored are the track selection and the keywords. We don't judge you on where you thought your work fits. We don't judge on the demographic information or the qualifications of presenters. We collect all of that information for descriptive purposes and to apply for the continuing education credits. And then we don't score anything around the type of session. And there is some discussion sometimes of like, where does this fit best? Skill sessions really need to be comprehensive in terms of describing what are you teaching or what are you training someone to do or what are the key takeaways and how will it be interactive. So if it doesn't fit that dynamic, we may ask you to present in a different format. And then for workshops, roundtables, and skill sessions, if we don't have enough space to accept all of the wonderful proposals that we get, we may ask you if you would still share your work in a poster. I realize sometimes it doesn't always translate, and we understand that, but we do really try to accommodate what people ask for. But we don't score on the type of session, and we don't score on the mode of participation, whether you want it to be in person or virtual. So what do we score on? So we are looking at these questions. So we ask reviewers to evaluate how well does the session support the theme of the conference? And this year, our theme is partnering with purpose. And if you noticed in the body of the submission, you could select that it was not related to the theme, but it is related to MCH. So how well does it support the learning objectives that you selected? How well does the post proposal center equity? We have lots of questions to help reviewers sort of understand and dig into the answers that are provided. So to answer this question, we ask reviewers to think about who was involved in the effort, who's leading, directing, or in power. Are the goals and intended outcomes reflective of the priorities, perspectives, and values of those most impacted? Is the framework for action reflective of the priorities, perspectives, and values of those most impacted? And how easily can you connect the effort being described to the broader pursuit of justice? So that aligns with our equity questions. Next, we ask, yeah, does the proposal meaningfully include someone with lived experience as one of the speakers? To what extent did the proposal provide all of the requested elements? And so, did it answer all of the questions to enable the reviewer to really understand what it's all about? And to what extent did the proposal describe what's relevant, impactful, cutting edge, or otherwise important about the work for the AMCHP conference audience? We do ask for the skills sessions, the workshops, and the roundtables. How interactive will the session be based on the description of the activities, skills, or tools? And that does not apply to posters. We mentioned that before. And then we do award some bonus points for how relevant the session is to families, youth, young adults, and family and youth leaders. So those are our review criteria for most of the proposals. And then we do have some special criteria for the student and early career professional roundtables, not so much scoring, but reviewer feedback, because these are work in progress submissions. So we ask our reviewers to treat this as a peer review and to provide a lot of comments back for the submitter, because in typical fashion, when we form up the roundtables, we do a lot of coaching and support with the people who are presenting. So they get this feedback. They get a summary of any concerns that might be expressed, like how to shape the actual presentation. And then we do ask the reviewers to provide comments that would help the applicant get the most out of their roundtable session. So those are specific to the student early career professional roundtables. So we do have lots more time for Q&A. But I did want to make sure I direct you to our conference page and to our call for proposals site. And I'll check the chat, but I'll probably stop sharing so I can see all of your names. Question, can we submit more than one proposal, one individual and one in a group? And there's no limit to the number of proposals that you can submit. So please, feel free to submit the right amount for what you'd like to do to express your work. I will say that you probably shouldn't submit a proposal on the exact same topic in a different format, because reviewers will, be looking at that and possibly make a recommendation that something should be in a different spot. I see Yvonne, did you have your hand up?
Yes, and I'm sorry I came on a little late. I wanted to make sure that I understood. In looking at the time slot, are you going to allow us to use the entire time slot, or will you be trying to put different people in the same time slot?
That's a great question. So typically, when you're submitting a proposal for an AMCHP session, you're assuming that you're going to do the whole session. So you may have, brought some collaborators together and put together a complete proposal. So like for a workshop, you would have the whole hour essentially. So and roughly 45 minutes of content, 15 minutes for questions, or you can do it a little more interactively. That being said, every year, almost every year, we get a number of submissions that are very similar, groups that are doing something very similar in two different states, presenting two different models on the same topic. And so we do sometimes do some matchmaking to see if you all would have a session together, because that is one, it would allow us to accept both proposals and more people can get a speaker slot at the conference. And it just makes sense, to have that synthesis and hopefully, maybe make new friends. So we do sometimes do that, but generally speaking, we're looking at these as one entire session proposal all by yourself or, with whoever you've invited. Great question.
Thank you.
Great. Let's see. I think you mentioned this earlier, but who will be in the audience at the conference? Sure. So we have some information on the call for proposals site about who will be in the audience. But generally speaking, we have people who are working in state governmental public health and maternal and child health, and then local MCH, people working in community-based organizations, family leaders, family councils, youth advisory groups. Um, I'm sure I'm going to miss again going back through the folks who are in schools of public health or academic programs, and just lots and lots of people working in this field. I think someone had asked, like, do we have a lot of clinical folks? Not as many, but there are some people who are in practice in different forums. I think we have people who are doing sort of direct service, people who are doing more enabling or infrastructure building type service. So it's really a wide audience, I would say. Let's see. How can we be updated about the potential scholarship opportunity? So that's a great question. If you go to our AMCHP conference page, let me go back and grab that link. At the bottom of the conference page, you can sign up for the conference newsletter. Hopefully that comes through. Oh, yep, there we go. So you can sign up for the conference newsletter, and anytime we have conference updates, anytime a new item comes out, then we're going to put that on the conference newsletter and you'll be able to get the update. So I think that's the best way to keep track of things. Let's see, I know someone had asked, I'm just gonna, maybe what I'll do is just share my screen for a second here to just take a quick look at the conference web call for proposal site if you haven't seen it yet. I think the one thing about this site is that it's very busy. There's a lot of stuff on here, but I think there's lots of great information, and I tried to distill it down in my slides to all of the pieces here. But the due dates are here. One thing that we didn't really talk about was that if English is not your first language, there is a Google Translate button. It's as good as Google AI Translate is, but if that becomes a barrier, please let us know. And then, you can scroll down through. So here are the learning objectives that I mentioned, the tracks, and here's a little bit about who attends the conference. So I think a number of you are interested in that. This is hopefully helpful for you. And then just to reiterate, who should submit a proposal? Like anybody who feels like their content is connected to maternal and child health absolutely should submit a proposal. This just gives you an idea of how we're trying to go beyond some of the people that we always have at the conference to expand our horizons. We do have an estimate in terms of how long it takes to pull things together. Our staff felt that it took about 4 to 5 hours to answer all those questions, to go through, especially if you have collaborators and want to share around your responses. But by the time you get to the point where you're going to fill in the forms, about 15 to 20 minutes to fill it all out. And then this has all the information about the session types, and then some suggestions around inclusive terms, and then the login piece. So I think this is a wealth of information for you, has the due dates, has the reminder that we won't extend the deadline, and then, yeah, good to go. Let me stop sharing. I see raised hand. Yeah, I know.
Hi. So AMCHP has historically been much more focused on sort of the national level of MCH, and so I'm wondering how relevant would much more local, like county-based kind of applications be for the AMCHP conference?
Yeah, absolutely. We're absolutely interested in hearing from you, from your work. I think as an organization, yes, we exist at the national level, but our members are in states and jurisdictions. So the work is happening locally. So absolutely, we're very interested.
Thank you.
Paul asked in the chat, as you're filling out the proposal, does it save so you can return, or does it need to be completed in one sitting? No, you can save it and come back to it. And I think someone had asked again the deadline, November 3rd, and I'm gonna say that I think it's wrong on my slide, even though I had 4 people review it. So I'm gonna make sure that the slides are correct when we post them and send them out so that there is no confusion. But on our call for proposal site, right at the top, November 3rd is when the proposals are due, and we are really motivated to get notifications out by December 15th at the latest. Any other questions? Michelle, I wanted to invite you to share anything else about the proposal process. I know your contact information is up on the site. I'm going to put my email in the chat as well.
Yes, the only thing I would like to say about our system is when you are completing your submission, you have to save your submission. And after you save it, you have to hit submit, which will be at the right-hand corner after you enter all of your information when you are ready to fully submit your proposal. If you just save it, it will be marked as incomplete. And I know that's an issue that our system has had. So please save, let the screen refresh, and then you're going to see the button to hit submit, and then please submit your proposal. Don't just save it because it will not be complete and then it will not be reviewed. And I think that's all I had. And I'll also just link, I will write in the box, in the little chat box, the AMCHP speaker email, just in case you guys have any questions. If not today, tomorrow, when you're going to do your proposal, I'm happy to answer any questions and guide you through what I can.
Well, I'm happy to hang out for a little bit longer if anybody wants to stay and chat about the questions that you have. But thank you so much for joining us. This is the first time we've done an open webinar like this on our proposal process. So hopefully it's helpful to you, and we're looking forward to seeing all of your proposals.
Caroline, I'll ask a question.
Yeah.
I was the one who was asking about evaluation, and there's a purpose behind that. I work for the CDC Foundation, and we provide evaluation technical assistance to build capacity of CBOs and PQCs, MMRCs to do evaluation of their efforts. And I'm just joining the team, so I didn't attend the conference last year.
Okay.
And I was just wondering, is there a need for evaluation among those audiences who are attending the conference? And if so, I'm thinking about doing a skills workshop
Yeah.
that we do. And I may need help to frame it to fit your questions, but that was what I was thinking when I was asking you the question.
Sure. Yeah, absolutely. And I'm more than happy to walk through that with you. I won't serve as a reviewer, so that should be totally fine. I'm available for technical assistance. And I would say, wearing my data epi hat for a moment, that absolutely there is always a need to build evaluation skills in the field. So my sort of completely biased answer is yes. But I think, yeah, I'm happy to help you sort of frame it and work through the criteria so that you can fit what you're thinking into that framework.
Awesome. I copied your email address. I'll shoot you a note in a day or two. Thank you so much.
Wonderful. No, thank you. Happy to answer other questions if you have any.
Hi, Caroline. My name is Saprija. Thank you for holding this webinar, by the way. This was super helpful. I'm a MPH student at UCLA currently, and my alumni from last year, they had recommended presenting my research at the conference. So but I was one who had asked a question about my program being implemented internationally. So I was doing an internship over the summer in Kenya, and it is entirely maternal and child health based, and the focus was on reducing maternal and child deaths in one of the counties in Kenya. So I know that the conference theme is more national slash local based, but how do you think I can kind of still align it to the audience who might be attending? Because my organization is American based, but what we do is we collaborate slash provide funding for specific countries where we see high maternal and child mortality rates. And yeah, this project is specifically in Kenya.
Yeah, yeah. So I think there's a few different things I would consider. One is what are some of the key takeaways? Maybe start from the end. What would you want someone to know about what you learned, through this process, and focus on thinking about it through that lens when you look at the questions, right, to fill out the proposal. Because I think it's less so about like, is an international project applicable to the audience? It's more so like, what could someone learn from your experiences, and start there. Because I do think there's definitely the opportunity, like I mentioned before, we had an entire conference theme on global meets local, and really trying to translate what happens in other contexts to the work that people are doing. So, what could someone take from the work that you did and apply to their own context? So, being able to connect those dots, I think, would be helpful.
Okay, got it. Thank you. And do you think it would be best for a poster or a workshop? Do you have any recommendations on what would be best based on our own proposal?
Um, so I don't want to say like, oh, it's absolutely better for this or that. My bias, having sort of come up through maternal and child health, is to just always shoot for a workshop, and unless you really feel like you don't have an hour's worth of content to talk about. But that being said, if sometimes things are a little more visual, more graphic, and the poster layout can be really helpful for that. So I would use, some of those sort of elements to guide whether you decide to do a workshop versus a poster.
Okay, got it. Sorry, one other question is for workshops, is it more us guiding folks through how this program was started, implemented, and then could be evaluated, or so like do we need to have a certain confirmed or a program that worked for us to be able to do a workshop, or can we present data in a workshop?
You absolutely can present data in a workshop. I would think about, from the perspective of like, even if you're going to choose the epi track, for example, so what's the story that you want to tell about that information when you're thinking about where does this fit in the conference? So you don't, it's not necessarily like most of our sessions are not necessarily going to be research projects. There's going to be a lot of program implementation. Here's what works, for this group, for this population. There's going to be a lot of sort of discovery things, like here's a problem we didn't know we had, and then being able to learn more about it and come up with some solutions. They may or may not have been tested yet. So things like that. We're I think a lot more. Our content is a lot broader than I think a straight scientific conference, and that's why we use a little bit of a different style of proposal too. We want to be thoughtful, because sometimes things are right on the cutting edge. You're just starting to get a sense that they're going to work, and you want to bring that to an audience, and maybe figure out how it could apply in another context.
Okay, got it. Thank you so much.
Great. Thanks for hanging in, folks. If you have other questions, feel free to unmute and ask.
Uh, yeah, I wanted to ask. I'm in Milwaukee, and in looking at templates and things, you don't have a conference template for your PowerPoint or anything like that. And do we have to do the first slide as a uh, you know, uh, disclosure, that type of a thing? Are you asking for that too?
So when we get closer to the conference, we will provide a slide template, a PowerPoint template that
Okay.
has the conference theme, to just to give you some inspiration in case you don't want to use your own. We don't we haven't required it. I should say, I don't know if we will require it this year. I think we'll
Okay.
wait and see. We are, I think, going to require that people use PowerPoint because it helps with captioning. So
Okay.
Canva does not work as well with live captions.
Okay.
So we will provide a template. We don't require a specific format or disclosures, but I think if you have a disclosure to make, it would be great to include that either right at the beginning or at the very end. But there's not a specific format for that.
On a minute late, so a couple minutes late, so I may have missed this, but what's the maximum number of presenters that can be added?
Sure. So you can have 3 presenters who will actually be speakers and 1 moderator. And that moderator could be, someone who's part of your group, or it could be someone who's sort of extra, who's just going to moderate. I guess what I'm trying to say is your moderator could also be a speaker. And you can add up to 10 more people as contributing authors. So they wouldn't have a speaker slot, like having more than 4 people, for an hour workshop is too many. It's really hard to coordinate. But you could include up to 10 people as essentially like acknowledgements that they are contributors to the project and the proposal.
Great, thank you.
Sure. All right. Well, thank you so much, everyone. I'm going to end our meeting.